Hello friends, this is Dr. Atul Kumar Vaibhav, MBBS from AIIMS Patna. I had secured All India rank of 694 in NEET PE 2025 in my first attempt and All India rank of 758 in INICET November 2025. So friends, in this video, I will be talking about a topic that is very close to my heart. That is why I didn't join MCh CTVS 6 years course at AIIMS Patna. So friends, not only this topic, but CTVS as a branch also was very close to my heart. It was not just a childhood dream, but I was really very passionate about it. One of the reasons being that my mother also got operated in the CTVS department at AIIMS Patna only. She was operated for mitral valve replacement. So yeah, I was very much inclined towards the branch, and I had seen the improvement in my mother's health after the surgery. I was very much fascinated by the surgery. So right from my childhood and till the very end of the MBBS also, I was very much fascinated by CTVS. I knew the department quite a lot. I had very friendly connections with all the staffs in the department and even all the faculties, and it was a very difficult decision not to join MCh CTVS in my own college, in the department which I knew very much, in a branch which I loved a lot. So it was quite a difficult decision to make, and I will talk about all about it in this video. I will talk about the pros and cons of CTVS, and I know many of you might have this dream of becoming a CTVS surgeon, that is cardiothoracic and vascular surgeon. And so I will be discussing all about it in this video according to my own experiences. And I think that I have gained a lot of experience after I had been allotted this seat in the first round. I talked to many people right from the JRs till the senior most faculties. And after brainstorming a lot, I came to the conclusion of not joining it. So I think I might give you a perspective to CTVS which many people won't be giving you anywhere on the internet. That's what I believe, and I hope that you will also feel the same after watching this video, and all your doubts or most of your doubts will get cleared about CTVS at the end of this video, and you will be able to make a better choice in your life and about your career. It is going to be a very important video, very useful video for all those who aspire to become future cardiac surgeons, and not only cardiac surgeons, cardiothoracic and vascular surgeons in our country. So let me begin. So first I'll give a little intro. So in INICET May 2025, my rank was 2579, and through the IP, that is the institutional preference, okay, I was allotted CTVS MCh 6 years course that is present in some of the colleges. So I was allotted in my own college through the institutional preference, that is in AIIMS Patna, the CTVS course, cardiothoracic vascular surgery course. I was very much excited to join because it was not one of my below choices. It was one of my top choices, good choices, because I was IP3. I was allotted this in IP3, that is I was the third person to get allotted a seat in the PG courses from my college. So it was quite a good IP position or rank, you can say. So I had I filled ENT or trauma surgery or emergency medicine or pediatric surgery before CTVS, then I could have easily got these branches. Okay, I arranged like this. I first arranged general surgery, then orthopedics, then CTVS, then trauma surgery. And these emergency medicine, ENT and pediatric surgery, I had not even filled in my choice list. Had I filled them, then I would have got it. Means I want to say that CTVS was one of my better choices, not one of my lowest choices. Okay, so I wanted to take it from my heart, but I didn't. Even though I had my mother operated in the same department, still there were many things that I did not know about it. Many things I was unaware of, and that I came to know after talking with many of my seniors, right from the JR level till the faculty level. And then I made this decision. So I will be talking about all those things in this video. So first of all, I would like to clear a very important doubt that comes in the minds of the people, that whether there is OBC reservation or some caste-based reservation or economy-based reservation like EWS in CTVS or not. Then the answer is no. There is no caste-based or economy-based reservation for the 6-year courses. Any 6-year courses, whether it be DM 6-year courses like in some places there is DM neurology, then there is no reservation, either caste-based or economy-based. And for MCH courses also, the 6-year courses do not have caste-based or economy-based reservations. Institutional preference, that is IP, that might get applicable in these courses, the 6-year courses, but the caste-based reservation or economy-based reservation is not applicable in these 6-year courses. So yeah, I had got the CTVS in the first round itself, but still I didn't go and join. So now let's dive into the core topic. So when I say that why I didn't join CTVS 6-year course at AIIMS Patna, then there are two parts to this question. Number one part is why I didn't join MCh CTVS 6-year course. That's one part to this question. And the second part is why I didn't join at AIIMS Patna. So both those questions I will answer in this video. So now let's begin. So what are the pros of CTVS? So it is a highly prestigious branch. Whenever one thinks about joining MCh CTVS, it's mostly because of the glamour, because we have seen right from our childhood that the top doctors and the owners of big hospitals in this country are MCh CTVS surgeons, like Dr. Devi Shetty, like Dr. Naresh Trehan, and like that. Okay, there are many MCh CTVS surgeons who are quite popular and quite rich also. So that comes in our mind, and till this date also it is highly prestigious in the society, because people don't know many of the things which I will be telling in this video. They think that it is quite an amazing branch. Okay, when I got this seat and when I talked to my relatives or my neighbors or whosoever that I'm getting in AIIMS Patna MCh CTVS, then they were very happy. They were telling, wow, what a seat you have got. Even my friends also, many of my friends told that it's quite a good branch, earning wise, reputation wise, very good. It's the topmost branch. Many people were telling, wow, you have got such a topmost branch. It's such a nice thing and it's such a nice college. So yeah, that was it. And when I didn't join this, then many of them said that, oh, you made a big mistake. Why didn't you join? It's not a wise decision. So yes, prestige wise, it is still one of the highest among all branches. Okay, and people love it. People respect cardiosurgeons. So their bhokal, which we say, their aura is just unmatchable, only matched by, I think, neurosurgeons in our society. So it's that high of prestige that CTVS holds. So that is a pro. The second pro is good income. So yeah, I will talk about whether this is a myth or not, but people think that the income is good. And even when I talked to one of my seniors in the CTVS department, then he told that income is quite good. And he told that in Patna, in one of a good hospital, in a good private hospital, there is a cardiosurgeon who earns a lot, and he showed him his paycheck of the that month, of 1 month, and it was 21 lakh rupees. So yeah, 21 lakh rupees in 1 month I'm talking about. That was his paycheck. But the thing is that he was a senior cardiac surgeon and he was earning this much. So yeah, whether this good income thing is a myth, I will be discussing it, and I will be discussing it in the cons section. Okay, so yeah, bear with me. So now coming to the cons. So number one con is the same as of any 6-year courses. See, we do not have the super specialty exposure in our UG days, in our MBBS days a lot. Okay, so we are not exposed to cardiosurgery or neurosurgery that much. As many people say, that taking a PG seat is like marriage. You are bound to that thing for your whole life. So since we do not have much exposure, and if we don't end up liking it in future, like we join and we don't like it, then we can't leave it in between. Or if we leave it in between, then what we will do, the flow of study will be lost, and it will be very difficult to get another seat, another PG seat somewhere else. Okay, so I even talked with the surgeon who operated on my mother. So he's not currently at AIIMS Patna, he has left and is now at some other institute. But I called him and I asked him, sir, that I'm getting MCh 6-year CTVS course and it had been my dream, so sir, should I join it or not? Then he said that, see, MCh after MS is not hard to get. That is, after MS also you can easily get MCh seat. So it is better that you do 3 years MS, so that you get exposed to various super specialties during your MS course, and then you can easily decide which branch to take. Because otherwise, if you will take now only, then you might regret it later, because we are seeing the outside glamour and we don't know the hardships, what lies inside. So we must know about it first. And he also said one thing, that you must become a good surgeon first, a good general surgeon first, and then you can take whatever branch you want. Otherwise, you will not be able to become even a good general surgeon also, and not even a good CTVS surgeon also. So you must do 3 + 3 years. And I've talked with another doctor also, and he's doing MCh urology course in AIIMS Patna. So I asked him that whether I should take or not. Then he also told that it is very easy to get MCh after MS in CTVS. So now the very important thing, one of the very important cons. Can you guess how many percentage of seats of MCh 3 years CTVS, that is after MS, that is of the INICET seats I am talking about, super specialty seats, that how much percentage of those seats of MCh 3 years get filled and how much remain empty? Can you guess? So the answer, you might get shocked. It is only 16 to 17% seats that get filled of MCh 3 years. That is, after MS, very few people opt to go for MCh CTVS. So it is in a severe declining phase. There is no other branch probably in whole of surgery, no other super specialty branch which is going through such a tremendous downfall. Even I would say, I would like to inform you that 1 seat out of the 4 seats in AIIMS Delhi was empty. Okay, so 1 seat out of 4 seats remained empty even after open round of INISS counseling I'm talking about. Okay, so this is the condition. So in MCh 6 years course, that is the direct 6-year courses, they get filled easily because people have no idea. Now I'm giving you some idea, but as they go into MS general surgery, then very few people want to take it. It gets very easy to enter. Even in AIIMS Delhi, like institutions which is the topmost of the country, there also 1 seat remains empty, and 4 seats allotted or 5 seats allotted in all other institutions of the country, including AIIMS Patna, AIIMS Reservation, all those places. These seats mostly go vacant. All of them go vacant. Okay, so to get MCh seat after MS, you just have to pass the exam. You just pass the INISS, you get the passing marks, you get through the interview, you will get MCh if you want to. So getting MCh in CTVS is not difficult. So it is going into a downward spiral, and the reasons for it I will be discussing in this video. So now another con, that is decreasing graph. Decreasing graph in terms of both popularity, in terms of the use or relevance, and in terms of money. I will talk all about them. Number one, popularity. The popularity amongst the doctors is decreasing. Those who know, they know in the surgical field also. So amongst your peers also, they will not be so amazed to know that if you join MCh CTVS, they'll say, yeah, it's quite easy thing to get. It's not such something of a big deal, and it is going to be replaced by interventional cardiologists. And so the popularity amongst your peers is decreasing. The popularity among the common people is good, is quite high. But amongst the doctors, amongst the surgeons, the popularity and the prestige is very less, amongst the lowest. So now the second thing is use or relevance. The most important. Many people don't care about popularity. This is something which they want to do, so they do. So for them also, I'm telling that the relevance of CTVS is declining, and it is declining a lot. Many of the procedures are being done by the interventional cardiologist people. The cabbage procedure, that is CABG procedure, that is coronary artery bypass grafting surgery, which used to be the bread and butter case of the cardiosurgeons, that is being taken up by interventional cardiologists. The interventional cardiologists don't do CABG, they do stenting, that is angioplasty. So they do the angioplasty procedure, which is much simpler procedure. CABG is much riskier procedure. It takes hours, and it involves opening up your chest and then stopping your heart and doing that open heart surgery thing, and then it's quite complicated procedure. It takes a lot of time, and stenting is a very easy procedure, just going through the artery, and the stent is placed there, and it is just done in 15 to 30 minutes or 15 to 20 minutes only, and it is a relatively risk-free procedure. So most people, they don't want their chest to be opened, they don't want their heart to get stopped and then surgery being done on it. So most people now prefer stenting for their coronary artery blockage. Yeah, for severe blockage and for severe cases, still CABG is being done, but the cases have reduced drastically. Okay, they have reduced drastically, and very few cases of CABG are being done now. Now coming to the second thing, that is valves. The valves which used to be replaced, yeah, still many valve surgeries are being done in the open fashion, but now valves are also being replaced using endovascular route. Okay, for example, there are procedures like TAVI, all those procedures are there, where the aortic valve and all, they just go through the catheter through your artery, and they just put the new valve over the old valve. So this is for example, the old valve, they go with the catheter inside and they just open the valve there, so that valve gets fixed there. So yeah, still the complicated cases and all are being done in open way, but things are changing drastically. For mitral valve also, there is those devices like the mitra clip and all, they are coming, and so all the things, many of the things are being done endovascularly by the interventional cardiologist people. So yeah, the cases are reducing drastically, and so is the popularity, so is the relevance or use of the cardiosurgeons. That's why the glamour is diminishing a lot, and it is truth. People will say, yeah, complicated cases, how can an interventional cardiologist do TOF surgery, that is for tetralogy of Fallot? Yeah, many cases are there which couldn't be done by the interventional cardiologist, but the majority of cases will be done by them, and very few cases will be left to be done by the heart surgeons. Okay, so mostly they will get limited to the thoracic part, that is lung surgery, or to the vascular part, that is the surgery for varicose veins and all, and those surgeries are also now being done easily by the use of lasers and whatnot. So yeah, the bread and butter cases of CTVS are being taken up by interventional cardiologists, and all those complicated cases are there which will never get replaced by the interventional cardiologist, but those cases are decreasing, and those cases are very rare and very less. And so the people in CTVS, as the days will progress, now also they are facing very much difficulty in getting cases, in getting good amount of cases, and in future this thing is going to reduce drastically. So yes, if anybody says that it's not going to be a dead branch or something, I personally believe that that is certainly very wrong, and it is definitely going into a steep decline, and it will probably be quite dead a branch. Now coming to the third thing in which its graph is going, the money thing. See, the senior cardiosurgeon that I talked about, who was earning 21 lakhs per month, that was a very senior cardiosurgeon, and to get that a much amount of money, and as the cases are also reducing, as I told you, then it will be very difficult. Currently cardiosurgeons are not making a lot of money. The cardiosurgeons are getting very less, like 2 to 3 lakhs per month or something like that. If they get experienced a lot, then they might get up to like maybe 7 to 8 lakhs per month, like that. So the amount of money is getting reduced, the competition is getting high, because cases are getting less, people are still there, the cardiosurgeons are still there. So to get established and to get popular and to get that much load of cases, and because cases are proportional to money, so cases will reduce, money will also reduce. Now I will be talking about something which is talked about very less, or you might not even heard it anywhere. That is the perfusionist factor. So what is this perfusionist factor? So there is this CPB machine, cardiopulmonary bypass machine, that is required for open heart surgeries, and that machine can't be run by anyone. Okay, like any person will run it. No. So there is a specific person who runs that machine, and he or she is called a perfusionist. So this perfusionist thing is very essential for your OT to work. If there is no perfusionist, the CPB machine will not be functioning, and you won't be able to do the cardiosurgery. So, and I will talk about it, that how it affects cardiosurgeries. So it is a very crucial factor. So this is one of the cons. You must have a perfusionist with you. So setting up your own setup is quite difficult, because you need a good team of nurses, a good team of anesthesiologist with you, and of course the perfusionist, he must be there with you. Plus you must have a very good ICU setup, you must have good CPB machine, and ICU facilities must be top notch, because cardiosurgery is not just about surgery, it is about the post-op management also. Post-op management is very crucial. So for best post-op management and to reduce the mortality, it is very necessary that you have a very state-of-the-art ICU facility available. So now the next con is steep learning curve. So yeah, the learning curve is so steep that even in your 40s, you might not get confidence to do big surgeries. And I have seen it. Okay, I will not name anyone like that, but I have seen that some people even struggle to do big surgeries in their 40s, because the learning curve is so steep. Operating on a heart requires a lot of skill. Okay, so yeah, to learn that skill, it takes quite a lot of time. And why it has become more of a steeper curve is because of the next con I am discussing. See, poor training at most places. This I have observed, that the training is also getting poorer. Okay, so you are not getting trained well in many places, and because of that, the things which you might have learned at a much younger age, now you will have to learn. Now you will learn those things at a much higher age, because you are not trained properly at many places. This is a truth and a fact. In fact, I want to tell a very interesting thing, that in certain colleges you might see even the professors who are fighting to operate on a particular case, because they have themselves no exposure or very less exposure of those cases in their residency. Even in their senior residency, that is after MCH, they might not have the proper exposure to those cases. So if there is some infighting amongst the professors themselves also to get hands on a particular case, like a CABG case or a complex TOF case or something like that. So yeah, this is one thing. So even if you become professors, there is struggle to operate, there is struggle to get cases and to operate, and the learning curve even remains even if you become a professor somewhere. So these things are demerits of cardiosurgery. Now, next thing which is very important is work-life balance. For example, now the cases, as I told, are decreasing, and mostly people don't get that many cases to operate. And for example, if you get a lot of cases to operate, in that case also your work-life balance will not be there. So if you are not doing something, then you will not earn the money. And if you want to earn the money, then your work-life balance will get hampered. If you are getting a lot of cases, a lot of complicated cases, for example, you are cardiosurgeon at one place, there might be many cardiologists and who might refer their complex cases to you. So you might get a lot of cases, but in that case, also your work-life balance will be hampered because cardiosurgery runs for longer duration, and you cannot charge a huge amount of money for a procedure. Even if the procedure lasts for like 3 to 4 hours, 5 hours, 6 hours, you cannot charge like 20 lakh for a procedure or 10 lakh for a procedure. The procedure cost will be procedure cost. However, if you are taking more time in it, it doesn't mean that you will earn more. Plus your work-life balance will be gone. Okay, you will not get time to meet with your family, to spend time with your family, with your parents. So it is a very important factor. In fact, when I was there, I wanted to take the branch. Then my father also told the same thing, that see, if you get into this and if you become a big cardiosurgeon, it's good, but yeah, you won't be able to make time for us or for your family, then what use to earn that much money? So it is a very important factor. Work-life balance must be there to live a happy life. Coming to AIIMS Patna. So now I will be talking about my own college, which I love a lot. In the AIIMS Patna Department of Cardiosurgery, CTVS, I got my mother operated, so it's quite an awesome department. So now I will discuss why I didn't join at AIIMS Patna. So the AIIMS Patna part, the pros and cons of joining there. Okay, so now, number one pros. The number one pro is that the faculty is quite good. They are very friendly, very polite, very soft spoken, and they are quite good at their work. They are very good cardiosurgeons. They operate very nicely. The faculty is quite good. Okay, now coming to the department is very friendly. The staff and all, they are also very friendly. Environment overall in the department is very friendly. Next pro is there is almost nil toxicity. The senior toxicity which we talk about, that the seniors are toxic or not, this is a very important question in the surgical branches. So no, in AIIMS Patna, so far as I know, there is almost nil toxicity. Okay, the workload is less. So it is a pro also and a con also. I will discuss about this also. The workload is less, so yeah, you are not overburdened with a lot of work. Okay, there is one ward that you have to manage, and so it is not very hectic. It's not at all hectic. So you will get quite a lot of free time, that I would say. Now next is early hands-on. Now remember, early hands-on is a pro, but you will not get lots of hands-on. Hands-on will be limited, very less, but you will get early on. Because like for example, you get MCh after MS, then in the third year of MCh, that is the final year of MCh post MS, you get hands-on. But here, by the second year only, or even in the first year, from the first year or second year only, you get hands-on. Because CTVS is not only cardiosurgery, it's cardiothoracic and vascular surgery. So the vascular aspect, the vascular surgeries, you get a lot of hands-on right from your residency, right from your second year only. And you get to do decortication and all those things from your third year or something like that. Decortication means opening up the chest and getting to the heart. Those are the initial steps that you will be doing during your residency only, during the first 3 years probably. So the hands-on is earlier at AIIMS Patna. They are not like those 3 years MCH courses post MS. It's quite early, but it is limited because, as I told, that the cases are less, the cases are complicated because you are operating on the heart. So most cases are done by the senior faculties only. You are there to assist definitely, but if you are thinking that you will get to do CABG and all those things quite early and all those things, no, hands-on will be very limited. The vascular surgeries you will be able to do, like varicose veins and all those things. Those surgeries you will be doing in your residency itself. Now coming to the ICU management, the ICU facilities are top notch. The cardiac care unit, the CCU or the ICU which is there in AIIMS Patna, is of the topmost quality, and it is not managed by anesthetists. At many places we see ICU is managed by anesthetists, but in AIIMS Patna, the residents of the CTVS department itself, the JRs of the CTVS department, they only do the ICU management. Okay, so ICU management they learn, and it is very important to learn during your residency, because for better outcome, as I told, a good ICU management you must be knowing. So all those ventilator settings and all those things, putting up central lines, intubating the patients, all those things, you will get a lot of opportunities to put the arterial line and all those things. Those are opportunities. The proper ICU management you will learn in AIIMS Patna. So this is a big pro. So another pro that I would like to add is that since nobody takes the 3 years post MS MCH courses, that is the 3-year MCH courses which happens after the MS, so these places are vacant, so you get to stand next to the faculties directly. You are JR 1, 2, 3, you just join the college in the CTVS department in the 6-year course. There is no SR there doing the 3-year courses, post-MS courses. So you get to stand next to the faculties and you get to assist them. So that is a very important pro in AIIMS Patna. So now coming to the cons. So number one cons is less cases, so less hands-on. Okay, very few cases will be there. So and the cases also get delayed because of many factors, because of the complications and proper assessment of the patient. So the cases are quite less. So hands-on, though will be early, will be quite less. Now second con is there is only one operation theatre in AIIMS Patna currently. So one OT is there, which limits the number of cases significantly. And the next con is the perfusionist factor, which I was talking about. See, sometimes perfusionists just leave their job and they go to some other places where they get more money. So in that case, your OT becomes dysfunctional for several months. It has happened in AIIMS Patna also that for several months, no cardiac surgery was done in AIIMS Patna. It was stopped in AIIMS Patna because the perfusionist went to some other place. So it is a perfusionist dependent thing. The thoracic surgeries and vascular surgeries were going on, but this cardio surgery stopped, and it resumes once a new perfusionist comes. So it becomes a challenge for the residents, because for that many duration you will not get exposure to the cardio cases. So it is a very important factor. So in this video I tried to incorporate all the pros and the cons regarding this field. Now I would like to summarize. CTVS, though, might seem quite glamorous from the outside, and it has a lot of reputation and a lot of prestige amongst the common people, amongst your relatives. They will think of you as the biggest surgeon. But yeah, the reality is grim. The pay is getting reduced over the years. The pay is getting reduced. The cases will fall drastically over the years. If anybody says it is not a dying branch, I think they are fooling you, because probably, according to me, I think, according to my experience talking to many people, I have finally come to the conclusion that it is indeed a dying branch, and should be opted if you don't get anything. 90% of the people told that it is I think more than 90%, 95% of the people told that it is quite a good thing. Yeah, you must take it. But those were the people who had almost no idea about it from the inside. From the insiders also, majority of the people were optimistic. But the few people whom I trusted and whom I contacted regarding this gave me the reality, explained me a lot of things which I explained you in this video. I talked with one of our faculties. Then I was informed that even heart transplant would be done till the time I leave the residency. Means till I pass out. Then till that time, even heart plant, they were planning to do even a heart transplant in AIIMS Patna. So yeah, people are optimistic. The surgeons are optimistic. But the harsh reality is that, which I came to know after talking to some senior people, some people who have really good idea about this, and doing a lot of research on this topic, because it was my dream. So after all these things, I say that it is really a declining branch, and must only be taken if you are not getting anything else. Then you can take this, and or if you are really passionate about it, if you don't care about money, if you don't care about less cases, or if you don't care about work hours, but you just want to open the heart, you want to see that beating heart, you want to operate on it, you want to get that thrill, then you must take it. Definitely you must just go there. If you think that you can't do anything else other than this, you were born to do this, then only take this. Otherwise, be cautious and consider all facts. Talk with the people in the particular department where you want to take. You must spend a little time going there and visiting the wards and all, getting a real perspective, talking not only to the residents but talking even to the faculties, or even the faculties who are established somewhere, who are not associated with that particular institution but are somewhere else. Then also then you must go and talk with all these people and make an informed decision. So hope you liked the video. It was very long video, but I tried to include all my experience in this video. So if you know a person who wants to take up CTVS in future, then you can share this video to them, so they can make an informed decision. They can know some truths, they can know the pros and the cons, and make their decision. And if you want more such informative videos, you can subscribe to my channel. Thanks for watching.